Welcome to the WeRPN Online Learning Indigenous Health Equity, Module 2, Cultural Safety and Cultural Competence in Indigenous Health, developed by WeRPN with the support of the Government of Ontario. In the development of these modules, WeRPN consulted with an Indigenous health subject matter expert who specializes as an Indigenous patient navigator. In addition, the modules were reviewed by an Indigenous elder. We thank them for their time and their contributions. Cultural safety is defined as a focus for delivering quality care through changes in thinking about power relationships and patients' rights, as described by Curtis et al. In 2019. Cultural safety goes beyond cultural awareness and sensitivity to focus on understanding power imbalances, marginalization, and institutional discrimination that can affect health outcomes, especially in the Indigenous community. It requires us as healthcare providers to reflect on our own cultural identities and biases and understand how these influence our practice. For example, at the point of care, an Indigenous patient who appears reluctant to share healthcare information due to past negative experiences with the healthcare system. A healthcare provider aware of the cultural safety principles might take extra time to build trust, actively listen, and reassure the patient that their cultural identity and experiences are respected. This could involve asking the patient if they have any cultural preferences or practices they'd like to incorporate into their care plan, thereby making the patient feel more comfortable and respected. We must respect and recognize Indigenous identities and traditions, ensure equity in treatment and access and care, and empower Indigenous patients to make informed decisions. Collaboration with Indigenous communities is crucial, and we should engage in reflective practice, continuously evaluating and adapting our beliefs, behaviors, and practices to eliminate biases, as emphasized by Ramsden in 2002. We can connect this to the College of Nurses of Ontario Code of Conduct, where one of the principles is providing safe, competent, and ethical care. As nurses, we are accountable for recognizing and addressing the unique cultural needs of Indigenous patients, ensuring their care is respectful, equitable, and empowering. By incorporating cultural safety into our practice, we uphold the responsibility to provide care that acknowledges and respects the cultural identities and traditions of our patients. This reinforces our accountability to deliver high quality, culturally competent care in alignment with professional standards. The College of Nurses of Ontario defines cultural competence as the ability of healthcare providers to understand, communicate with, and effectively interact with patients from diverse cultures. This involves being aware of our own cultural worldview, having knowledge of different cultural practices and worldviews, and being able to manage cross cultural relationships. Importantly, it includes addressing specific cultural needs and health disparities faced by Indigenous populations. Cultural competence in healthcare starts with relationship building, which is especially important when working with Indigenous populations. It requires a deep understanding of the diversity within Indigenous communities and recognizing their unique cultural practices, beliefs, and languages. To provide culturally competent care, healthcare providers must respect and honor these differences by adapting their care approaches accordingly. Developing skills in communication and interaction that respect cultural and linguistic differences is essential. Moreover, we should commit to continuous learning, ongoing education, and self reflection, as highlighted by Brascoop and Waters in 2009. Let's say, for example, that an Indigenous patient goes to a clinic with a preference for traditional healing methods alongside conventional medical treatment. As a culturally competent nurse, you would engage in open dialogue with the patient, asking about their specific cultural practices and beliefs. You might say, "Can you tell me more about the traditional healing methods you use and how we can incorporate them into your treatment plan?" By doing this, you show respect for the patient's cultural values and adapt the care approach to include traditional practices, ensuring the patient feels understood and respected. Additionally, you continuously educate yourself on Indigenous health practices and reflect how your own cultural background influences your interactions and healthcare delivery. Cultural competence starts with relationship building, asking the patient about their ways of being and beliefs. It is important to understand the differences within Indigenous cultures, including First Nations, Inuit, and Métis communities. Indigenous health is holistic, encompassing physical, mental, emotional, and spiritual well being. Many Indigenous people incorporate traditional ceremonies such as using traditional medicine and spiritual well being. There is also a strong emphasis on community and family in healthcare decisions. It's essential to be aware of historical injustices and ongoing challenges faced by Indigenous people. Key cultural practices include respect for nature, language, and communication, ceremonial practices, and creating a culturally safe environment. There is a deep respect for nature and a strong connection to the land. Understanding the significance of Indigenous languages and how communication styles may differ from Western norms is crucial. Participation in traditional ceremonies and rituals is integral to the cultural identity and health. By recognizing and valuing these cultural identities, we can create culturally safe healthcare environments. Trust is essential to fostering culturally safe environments. To build trust, we can begin by displaying Indigenous signage and artwork in healthcare settings, as suggested by the Government of Canada in 2020. Building trust through respectful relationships and active listening is key. Providing ongoing cultural competence training for healthcare staff is essential. Using respectful and inclusive communication methods and engaging Indigenous patients and their families in care planning is also important. Finally, developing inclusive policies that promote cultural safety, as advocated by the First Nations Health Authority in 2013, is crucial. Regular self assessment of cultural competence and biases is vital. Approaching patient interactions with cultural humility and a willingness to learn can greatly enhance the quality of care. We should advocate for incorporating Indigenous perspectives and practices into healthcare policies and collaborate with Indigenous healthcare providers and community leaders to assure culturally appropriate care.